Hello everyone, welcome. I'm Dr. Shariful Halim and today we are going to discuss about defense mechanisms and we are going to discuss end the part of immature defenses today. So one of the very important immature defense is reaction formation. So look at the words reaction formation. So you react in an opposite way to a situation or to an impulse or drive. So you replace a worded of idea or feeling by emphasis on its total opposite. And this is there is a very important difference between reaction formation and sublimation. Sublimation is a mature defense mechanism when you take the feeling and you use the feeling to do something else. But in case of reaction formation, you take the feeling and you change the feeling to its just opposite of the feeling. So here unacceptable feelings are denied and opposite attitude and behavior or feelings are adopted, which is actually call it as unconscious hypocrisy. So here there can be a global reversal in which love is expressed as hate or reverse, hate is expressed as love. So maybe a patient who is having some libidinous thought now enters a monastery. A woman who is angry at her physician tells him that she really likes his watch. Another one, a woman who unconsciously is resentful of the responsibilities of child rearing overspends on expensive gifts and clothing for her children. Another example is a student who always wanted to be a physician expresses relief and says, "This is the best news I have ever heard after not being accepted into medical school." Another interesting example is a teenage boy, intrigued by dirty pictures, organizes an anti-pornography campaign. Another very interesting example is two co-workers fight all the time because they are actually very attracted to each other. So here, excessive overreaction actually can be a sign of reaction formation. So this is like as if the person is trying to convince self or anyone else that the original feeling or impulse did not exist. So I'm fighting with you because I don't like you. So you're trying to convince the person by fighting that you don't like her or him. But actually you like him, you do like him or you do love him, but you're expressing in a different way because you don't want them to know the feelings that you are having inside. So you are trying to convince them and also you are trying to convince yourself. So here the unacceptable are transformed into its total opposites. Regression is a very common defense mechanism. So here the people actually turns back to the maturation clock and they go back to the earlier mode of dealing with the world. And here they actually behave like a child. So childlike patterns of behavior especially appear after stress. So it is commonly seen in older children. So older children under stress like illness, punishment, or birth of a new sibling actually tends to reverse them to earlier level of functioning. Suppose a new sibling is born, now a previously toilet trained child is wetting his bed, or when a new child is born, the older children who have been weaned now may demand to go back to breastfeeding. Our interesting example is a hospitalized 48-year-old patient refuses to eat anything except for French fries and ice cream. Another common example is women insist that her husband stay overnight in the hospital with her before the surgery. Okay. Another important thing is play is a regressive, more free and simpler expression from an earlier age. So playing is regressive. Even sex is also a bit regressive. The regression are common when people are tired, ill, or uncomfortable. Repression is another important immature defense mechanism. So here the people actually withhold some idea or feeling from the conscious awareness and they put it in the unconscious awareness and they do it all involuntarily without knowing that they are doing it. So here they push unacceptable feelings into unconscious. So the content may have once been known, but now it has become inaccessible like a hidden folder. So, and a common example might be a 20-year-old does not remember going to counseling during his parents' divorce 10 years earlier. An adult does not remember that she was sexually abused as a child. A man who survived 6 months in a concentration camp cannot recall anything about his life during that time period. So, interestingly, you forget and then forget that you forget. You forget and then forget that you forgot. Interesting. So, here you one sentence forgetting, so it is not retrievable ever. So you cannot find out that folder. It's down under, deep inside your mind, and you cannot retrieve it. So splitting is very important, and here the persons with splitting believes that people or situations are either all good or all bad at different times. The change is their criteria because they don't actually tolerate the ambiguity of situations or peoples. So it is commonly seen in borderline personality disorders. And common example is a patient says that all the nurses are cold and insensitive, but the doctors are warm and friendly. A woman who believed her physician was godlike begins to think he's a terrible physician after he is late for an appointment with her. Another patient says, this doctor is a miracle worker, but that doctor is totally rubbish, totally incompetent. So she is actually splitting, and she is actually doing it all good or saying it all bad. A teenage girl might say when she fell in love in someone, he's so perfect and wonderful. And maybe some days when she breaks up with that person, she'll say, oh my god, this was the worst person I have ever met. Things goes like that. And no one from that family, another person says, no one from that family will ever amount to anything. They are all just plain no good. So this is how you are actually marking everyone as bad. So prejudice and stereotypes are often the result of splitting. And here, in case of splitting, the world is composed of polar opposites. Very important to know. Another common defense mechanism is intellectualization. So here, you use the higher functions of the mind to avoid experiencing emotions. And here, you strip off your affect or strip off your emotions or feelings, and you replace it by an excessive use of intellectual process. So the cognition or the thinking replace the emotions or feeling. Thinking replacing emotion. A common example might be a physician who has received the diagnosis of pancreatic cancer, which is a very emotional, very extreme feeling. Now he is actually telling, or he's actually discussing the technical aspects of his illness, the statistics of the illness with his colleagues and family with excessive manner. So he is actually filling up his mind with the things or facts or intellectual things, and he is actually suppressing his emotions deep inside. A sailor whose boat is about to sink, which is a seemingly emotional situation, very emotional situation, a situation where you should panic. Now he is not panicking, rather he calmly explains the technical aspects of the hull damage in great detail to other crew members. So the technical aspects or the cognition is actually taking in place of the panic that they should have experienced at that time. Another patient who has actually had a open fracture of the tibia now tells to another patient or the staff, notice how the bone is protruding from my leg. It is interesting to contemplate the physics that allows such an event to happen. So he is actually saying, he's actually replacing the feelings, the bad feelings associated with the fracture that he has got, with the intellectualization of the situation. Okay, so those intellectualization are associated with obsessive compulsive personality disorder. And here, in one sentence, affect is replaced by academic content. Another defense mechanism is undoing. So here, the people with undoing believes that he or she can magically reverse past events caused by incorrect behavior by now adopting correct behavior, like atonement, confession, or penance. So acting out in the reverse of unacceptable behavior, which he or she believes will repair or fix the impulse that he previously had. A common example might be a woman who stole money from a friend, confesses to the theft, returns the money, and then feels compelled to offer to drive the friend to and from work for a year. Another common example is a man who is sexually aroused by women he meets immediately leaves and buys his wife flowers. So here, the feeling which is sexually arousal again to another woman was a bad feeling. So these were incorrect behavior, and she's correcting this incorrect behavior by doing something good that he believes will repair or fixes the impulse, which is buying flowers for his wife. Another example is penance after confession, or making the sign of cross to ward off anxiety. So obsessive compulsive behavior like repeated hand washing is also one type of undoing. In one sentence we can tell action to symbolically reverse the unacceptable. Blocking is another defense mechanism where the patient or the people have a transient block in thinking or memory. So someone might be talking to someone like Mr. Jones, you are suffering from okay, I just can't remember what it's called. So this person, maybe a medical student or maybe a doctor, has just temporarily had a block in their thought. So he or she cannot remember what actually was the diagnosis. So this is temporarily block, it will go away. A student is unable to recall the fact needed to answer the exam question, although he recalls it when he walks out of the exam. Or another example is in the middle of a conversation, a woman pauses, looks confused, and asks, what was I thinking about? So this is all from me today. Thanks for watching my video, and I will also make one on match your defense mechanisms.